works. Okay, so I'll be talking about businesses that use technology, price, and quality to change the competitive landscape in favor of the consumer. And I'll be drawing upon my experience working in eye care, and I've helped develop many of the major eye care programs in the world to make them, excuse me, to make them self-financing from user fees, but still serving lower income people. So I'm going to talk about how we've had an effect on the whole ecosystem in eye care, the interplay of affordable technology combined with cost-effective and efficient service delivery, and the business model, the social enterprise business model that has the right control and governance to ensure fidelity to social mission, which in this case, which in all cases has to do with accessibility and affordability. And I'll talk about how we've applied these lessons in eye care to hearing. So I'm going to give you the punchline at the beginning of the talk. The various lessons that we're now applying to making hearing affordable and accessible have to do with creating business models that are self-financing for all economic strata. That is, they're self-financing from patient fees and not dependent upon any insurance reimbursement system, and where there is tiered pricing, where free is the lowest price, and revenues are used to cross-subsidize care for those that can't afford or pay below cost. And it has to do with creating business models that utilize choice, the choice to use production capacity and pricing and margin to serve lower economic strata. And probably the major point is that price is used to change the competitive landscape in favor of the consumer. How do we use a new price point with good quality and good outreach to underserved populations to change how other providers, whether they're product manufacturers or service delivery models, how do we get them to also make their pricing affordable? Well, we do that through competition in price-sensitive markets. And then also, how do we have the right control and governance in a business to ensure fidelity to this social mission of affordability and accessibility? And also, how do we add in reducing time between all the different moments when you see the client, you detect something wrong, and you provide treatment? It's I call it the David Green law of propinquity, proximity and time. How do you reduce that time? And then I'm going to be talking about a whole ecosystems approach about how you reduce costs and margins throughout the whole system in order to arrive at affordability. And that a lot of that is really removing what I call non-value added margin. And then how do you be in control of this system to ensure fidelity to that business model? So these are the major points that I'll be referencing throughout my talk. So eye care affects maybe 285 million people are visually impaired, and of these, 39 are blind in both eyes. Cataract's the main cause of blindness. So I've helped develop many of the world's largest eye care programs that provide comprehensive eye care services with an emphasis on cataract, since that's the main cause of blindness in the world. And so I've helped over 300 programs become self-financing, doing about 1 million surgeries a year. And perhaps the best known one is Arvin Hospital, which provides over 370,000 surgeries a year. And they have a model where 51% get service either for free or below cost, and the remainder pay well above cost, and that margin is what's used to cross-subsidize. And so even with this cross-subsidization, Arvin in 2012 was still able to make a 33% margin. That means that for every dollar they spent, they made $1.33. So we've helped spread this model around the world in eye care. And I don't know if this is a video of, thank you, an eye camp in South India, and we do about 1,500 eye camps a year, and community organizers get the patients to come. Could you turn down the volume of that? Thanks. And so a team from Arvin tests vision, a doctor examines the patient, and those needing cataract surgery get patient counseling and then are taken immediately for surgery. Those needing refraction get their eyeglasses immediately after they get their prescription. So again, that law of propinquity. And in this way, we do about 150,000 surgeries a year. And so a big part of this is patient counseling. And we take them immediately to the hospital because Arvin is well known. Patients come knowing that if they have an eye problem, they'll be taken immediately. If we have the eye camp on Sunday, they go to the eye hospital on Sunday, they have their surgery on Monday, and they go home on Tuesday. And so they have a very comprehensive setup to do high volume surgery. And as you can see, surgery's a lot more complex than fitting of hearing aids in terms of the sterile environment and all the different jobs that you have to have. So I just wanted to give you a, can you forward it somehow? Okay, there we go. So this just shows how Arvin has served, it's helped many programs become self-financing and adopt this model of sustainability with total access, where free is really the lowest price. Another group I work with is in China. Excuse me. The Her Eye System does about, now it's up to about 40,000 surgeries a year, and 32% are free or below cost, again with that cross-subsidization model. Here's one in Egypt. In 2009, they did over 10,000 surgeries, and 43% of their cataract surgery was done for free, and the paying surgery was only at 25% of the market rate. Here's a hospital I developed in Nepal, which is one of the 10 poorest countries in the world. They did 47,000 surgeries and still made a profit of over $200,000, charging a price of $33 to the majority of the patients. Here's a group that I work with, the Grameen Eye Hospitals. I've helped set up 2, and now we're doing 7 altogether in Bangladesh, which again is one of the 10 poorest countries of the world. And these hospitals are all self-financing and providing at least 30% of their surgery for free with sustainability. And here's one in Guatemala. So the whole idea here is really to convey to you that in eye care, which has a high degree of complexity, we've figured out how to make eye care self-financing from user fees, where we use our margin to cross-subsidize and serve others. And here's another one in India. Now it's up to like 117,000 surgeries. Okay. And here's one in San Francisco. We're taking what we learned in all these different countries and applying it to how to deliver eye care to the uninsured, the undocumented, dual eligibles, Medicaid patients in a way that removes barriers to access in this environment. And this gives you an example of some of our analysis where we compared Arvin cost, labor cost for surgery with Vancouver's cost, and basically figured out that what cost $460 in Vancouver cost $2.19 at Arvin. But if you were to apply Vancouver prices for the Arvin staff, it would end up being about $80, which kind of shows how there's a level of efficiency that's been achieved that the West would do well to emulate. The other major area that I do, and this has to do with addressing whole ecosystems, is developing affordable products. And so a lot of this is in parallel to what we're doing in Sound World Solutions for making hearing affordable. So in 1992, I set up manufacturing to make intraocular lenses. And now Oral Lab has 10% of the global market share for intraocular lenses. They sell about $2 million a year, and our lowest price lens is $1.75, and this is for CE mark certified lens. We also make suture, which has both CE mark and FDA marketing clearance, and we make pharmaceuticals. So it's all about the shape of a business model that chooses to price its products for affordability, and in this way, they have an effect in changing the whole competitive landscape. And even though our product, our intraocular lens, sells an average price of $3.50, we still have a 40% margin on all these products. So it has to do with how you sculpt the business model, that not only your cost, but your margin. So here's some pictures of Oralab manufacturing. And it's state-of-the-art manufacturing. It's the same that you would find anywhere else in the world. And here's some of the suture. We sell it for $23 a box. The competition sells it for $240 a box. And pharmaceuticals also, we make about 60 pharmaceuticals. And so here's one of the main points of this talk, and that is changing the competitive landscape with price as the lever. When Oralab got going in 1992 making intraocular lenses, the prevailing global price, including in India, was $300 a lens. We came to market with a $10 lens. And then all these other competitors popped up around us, primarily Indian companies, that actually competed our price down to less than $2 a lens. But in the meantime, India's surgical volume in just 10 years went from 800,000 to 6 million, driven by this very competitive ophthalmic industry that was price competitive, which is something that you really don't see in the United States. You don't really see price competition in the medical system. There was another example of a very large company where we beat them out on a contract for suture with the government of India. It was $1 million contract. They were very upset and sued us, claiming we didn't fulfill the bidding requirements. They sued us, they lost, and then they won on appeal, and we took it to the Indian Supreme Court and ultimately won that case with a company that is, it's a $5 billion company. But in the meantime, they actually reduced their bidding price from $240 down to $23 to beat us out on the next bid. So again, it's an example of how you use the forces of competition, price competition, in favor of the consumer. Here's an example of how we sculpt not only cost but margins to result in affordability. Back when we made 1 million lenses in 2007, we had revenue off of those lenses of about $5 million. Alcon, which is our biggest competitor in Asia, sold 7 million lenses with $920 million in revenue. So if you were to multiply Oralab by 7, they would be a $35 million a year company versus a $920 million a year company. So this is an example of how we sculpt business models to not only cost but margins, and how we create the whole distribution to result in affordability to the end user. It's a completely different margin model tuned to the needs of lower income people. So now I switch to hearing, and as you know, the WHO statistics say that 278 million people have disabling loss, and another 340 million have a mild or moderate loss, and yet only about 7 million hearing aids are sold each year, and only 10% go to the developing world. And these numbers haven't changed. And so we created, so there's the market needs, and I'll get into Sound World Solutions now, and just to make a disclosure, I do own shares in that company, just so that you know that. So people in both developing and developed markets, they all really need the same thing. They need clarity and amplification in real-world environments. They need lower price hearing solutions. They need easier access, simpler process for buying and fitting the product. And in our case, we like to simplify it even further to have real-time in situ adjustment of the device. And it's easier to use, especially with regard to batteries. So this is my disclosure. And so what we've come up with is technology. I'm actually wearing it. I'm wearing it in both ears. I know I look sort of goofy wearing what looks like a Bluetooth headset in both ears. But basically, this is a Bluetooth-enabled hearing aid, and it's also a Bluetooth-enabled sound amplifier. And you can download an app. You can actually adjust it right on the device, or you can download an application to a smartphone or a computer, whether it's Android or iPhone or Mac or PC, and you can directly adjust the device using Bluetooth technology. So we're actually ahead of GN and Resound and Apple in delivering this functionality to the market. And I helped create Sound World Solutions with my colleague Stavros Baseas, who's here. Stavros was the chief technologist of GN Resound. And I think over the years he was quite frustrated at not being able to serve a broader segment of the market. And so wanted to see how we could develop technology. And in this case, we took what was already out there in consumer electronics and created this product with our own software, with our own algorithms. And I should mention also that I earlier on tried to create a solution with traditional hearing aids. Actually, I got Auralab up and running producing hearing aids, but that company failed for a variety of reasons. But the main reason was that we underestimated the cost and complexity of creating fitting in emerging markets, because you need an audiometer, you need a trained you need a trained audiologist, you need a sound room, you need a computer, you need a high-pro box, you need the cables that go from the high-pro box to the hearing device, which, those by themselves cost $100. So there's quite a bit of cost and complexity that we underestimated, and that project failed. And so when I met up with Stavros, it was really going back to the drawing board and creating a new product. Let's see, it's not advancing. Can you advance it for me? Thanks. Creating a technology that was originally targeted to the great unmet need in the emerging markets. And so we created a technology platform that enables fitting directly on the device or via a variety of computing technologies that has directionality, noise control for both telephone and application mode. It has a directional mic. It has in situ fitting. This is actually a Bluetooth headset. You can use it with cell phones or music streaming. And we're releasing it both as a personal amplifier with limited output and as a hearing aid with maximum output of 130 dB with 70 dB of gain. And so, as I mentioned, we're the first to have a smartphone app directly controlling the device without the need for any intermediary device. It's a 16-channel with 24-bit resolution. The chip in this hearing aid, in this device, is from the Bluetooth chip industry. So the company we buy it from sells $1 billion a year. So we don't have all the development costs that hearing aid companies have for developing a proprietary chip. We're using a very robust chip that probably has more processing power than any hearing aid chip. And it has all the features that you'd see in advanced hearing aids with signal processing, which you can see here, all these features. The other thing that we did, again, for the emerging markets, and this is taking into account the David Green law of propinquity, we created a mold system made out of a proprietary material that doesn't vibrate, which you can program it for severe hearing loss where you don't have the feedback sound, and you don't have to make a customized mold. And we also have a rechargeable battery. And for the behind-the-ear version coming out, it's a 16-hour battery. So we have a strategy for the emerging markets to work with pre-existing programs, social enterprises, and also eye care programs. A lot of our initial distribution is through eye care programs that I helped develop that basically serve the same demographic that is hearing impaired, that is the cataract patients. And we have a training program that trains their technicians to be fitting this product, and we're helping them develop a whole business model and pricing system around that. So this gives you an idea of the comparison of our product, where we hope to make it affordable and available with minimal time used for fitting. Okay, so in the U.S. and we're looking to spread this product to underserved communities through federally qualified healthcare centers, American Indian clinics, different Spanish-speaking clinics and organizations, county health departments, and home healthcare agencies. And what we want to do is reduce cost and price and focus on making this product affordable and accessible, where it's really about fee for service rather than being a part of any insurance reimbursement system. So we want to make it affordable to the pocket of the client. These are some screenshots of our consumer version. And just to finish up on the point, it's not about reducing costs. It's really about changing the entire business model, the entire ecosystem, to result in an affordable product. And so it has to do with using technology and looking at new and different channels for how this product gets out to people to provide assistance in ways where, you know, we hope that our price point, our accessibility will change how the rest of the providers behave, so that hearing can become more accessible and affordable. Thank you very much.
Our next speaker is Stephen Berger from DEM Consulting about the function and importance of wireless standards.